Thank you very much, Mr Speaker, and I'm very happy to respond. In particular, we are referring to, of course, the issues in relation to the Holy Spirit Home in Castledean, where a doctor failed to complete the training and where the doctor subsequently administered a higher than prescribed dose. A number of steps have occurred. Firstly, the Secretary of the Department has met with and spoken with both the CEO initially and also with the Chair of the company. I'm advised that the CEO is being stood aside as a consequence of the discussions, and that in particular that the company is installing new management. They are bringing in additional management. It is a company that is currently employed or has been employed through the course of the pandemic by the West Australian Government, by the Victorian Government, by the Northern Territory, by New South Wales, and has a long history of employment on that front. In addition, at the government's request, the former Chief Nursing and Midwifery Officer of Australia, Deb Toms, has been installed to oversee clinical guidance. In addition, there has been a review of the mandated and required training, which was part of the contract of the company, which it was in breach of, and that it has been confirmed that every person involved with a clinical role in the vaccine has completed that training. That has already been done, has already been reviewed, and has already been confirmed by the department. In addition to that, what we are doing is bringing in additional clinical support in New South Wales and Queensland. And so that's been a direct response under the guidance of Professor Brendan Murphy, who has met with the company. So there was a breach, a clear breach, a breach of the required standards by the individual, a breach by the company, which not only failed to meet their contractual obligation, but also, very significantly, provided false advice, but as we can see, serious consequences, but above all else, safety procedures put in place. And I can inform the House that prior to question time at approximately 1 p.m, the Deputy Chief Medical Officer and myself spoke with the Chief Medical Officer for the Metro North District in Brisbane, Dr Liz Rushbrook, who is overseeing the clinical care of the two patients in question, the 88-year-old male, the 94-year-old female. Her advice to us is that both have been unaffected, both are in very strong health. There have been no adverse impacts, and indeed the woman will be returned at the request of her family to her facility this afternoon. The male will stay in hospital for a prepared, already predicted elective surgery procedures. So both are in good health.